Good afternoon, everyone. Hi, happy Friday. How are we doing today? Natural holistic medicine therapies. We're talking about fertility health. Okay. Good afternoon. Improving fertility with natural holistic medicine and therapies and fertility coaching. Ask a question, feel free to share your journey. We are talking about fertility health. We're talking about if you are trying to get pregnant and you are stuck on your journey. Things are not working out, you don't know what to do, you have been told a lot of different things. So let's see if we can create some clarity, take away the confusion, and give you a better, wholesome solution. That is the aim here. So, who is trying to get pregnant right now? What kind of situation are you dealing with? What have you been told? What kind of investigations you have done? How long have you been trying to get pregnant? That is the topic here. Feel free to share, connect. Welcome everyone, everybody who is here today or will be here soon. Thank you for being here. We are talking about fertility health. So tell me about your fertility journey. Hi. Good afternoon to everyone. How is everybody doing today? Good. How can I help? I am always doing great. Thank you. Natural ways to improve and enhance your fertility, natural ways to increase your AMH levels, natural ways to improve your egg quality, natural ways to improve sperm quality, what kind of natural holistic solutions you can use to improve your health for you to get pregnant faster and healthier. That's what we are discussing here. That's what I do. My name is Ashish. My clinic is called Ashish Veda. We are based in central London in Harley Street. For the last 11 years, I have been supporting women and couples' health with bespoke natural fertility medicines, with bespoke natural solutions. We do Ayurvedic treatments, all Ayurvedic therapies we offer from Harley Street as well. I do see patients across the world as well. We are actually, our herbal medicines and herbal fertility herbs are becoming really popular. More and more women are using it and getting results. So that is something really, it makes me really happy that more and more we are able to reach out to more and more women out there. So feel free to ask a question. If you're stuck on your journey, let's find a solution. Can you tell for those with PCOS? Can I tell what, Aisha? What's the question? Ask your question. What is your question? Holistic fertility solutions. Do you know someone who's trying to get pregnant and they have been told lots of different things? It is never going to happen for them. Egg quality is low, lining is this, and what kind of things have you been told? And how are you improving your health? What are you doing holistically? What are you doing naturally? How are you working on your diet, your nutrition, your lifestyle, your sleep, your stools health, your sexual health? How are you working on all of these factors? Aisha, what is your question? Taking inositol for PCOS, right? Okay. What is the question? Holistic fertility, holistic solutions for your fertility. If you are somebody who is going through, is in the middle of thick of fertility jargon and you don't understand what is happening, feel free to ask a question. I support women and couples and men also who are on their fertility journey, trying to improve sperm health, trying to improve overall health as well, to support their partners. We do natural holistic fertility remedies, therapies, treatments, and also coaching, also breathwork training, all of this. So, how are you and your partner, both of you, improving your health? Right, Aisha, what have you done so far to improve your health, especially your diet and nutrition? Are you working with somebody? Have you taken some solutions? What are you doing? Diet changes. Have an online coach. Okay, so what is coach working on? What kind of dietary changes? How long have you been working with this coach? 3 months. Okay, good. So what kind of changes have you seen? What kind of high protein are you eating? Is this coach trained to give you some herbal medicines? Then ask her to give you some herbal medicines. Walk daily. Okay, how long are you walking for? Holistic fertility is what we are discussing here. Holistic fertility is the topic here. This is for women who are trying to get pregnant with PCOS, endometriosis. What is it that, how are you supporting your health? How are you supporting yourself as a human being? A human being who has got emotions, who has got psychological issues, who has got mindset issues. How are you supporting yourself? Not just only your body as a medical, as a medical kit. She told me to start with inositol and walking 30 minutes, right? Inositol is a usual supplement, so which you are taking is fine. You are walking great if you're working with her. If she is not a herbalist, then find another practitioner who can give you herbal medicines. Take herbal medicines. Do more for your health. The main change is going to happen with your foods. How you cook them, how you eat them, the portion size, the timing of the food, and of course exercise and everything. Are you doing any breathing exercises? Is she teaching you any breath work? Alonzo, how many months to get pregnant again after implant removal? Which implant was this? Implanon. What is Implanon? Contraceptive implant. What is this? Contraceptive implant, good for 3 years. Okay, fine. Nobody can tell you when you will get pregnant, but you need to, if you have stopped using it, you need good 6 months, maybe longer, because you have had it for 3 years. So you need some time. Your body needs time to ovulate. Are you tracking your ovulation? What is your thought on 2CB embryo? Can it be successful? If you only have that embryo, then what you do need is, if you have some time, prep yourself, improve your health, take herbal medicine, do natural therapies, do breathing exercises, work on your nutrition, and then have it. There are better chances of it implanting. Grading is still very vague, so, but don't take chances if you are not working on your health. Then there are not that much chances. Even good quality embryo won't have that much chances if your health is not where it needs to be. How's your health? Who was asking question? User number. Do also check out our website. We do have number of guides available. There are herbal medicines available on the website as well that you can check out and even order directly if you want, or you can do it properly, book a consultation and then take natural fertility herbs. That way you can also do. So check out the website, check out various guides that are there. ashishveda.uk. Fertility, health. Who else has a question? Who has a question? What is not working in your health? What is not going your way on your fertility journey? Good afternoon, everyone. Happy Friday. I hope you're having a great day. If not, make it a great day. It's in your hands to make your day a great day. Fertility, health, fertility questions. I've also shared a video about our uni oil today as well. I've been talking about this particular remedy out of our set of 9 fertility herbs that we have listed on the website that I give to my patients. I've been using these for last 10 years, 11 years now. So do check out that video as well and reach out if you're looking for natural herbal medicines to support your fertility. Doesn't matter how you are trying to get pregnant. You can use herbs at every stage in a different format, perhaps in a different way, different dosage. It could be any of those, but you can use herbs but proper herbs. We are not talking about taking over the counter herbs. Mel Dawson, tested positive for ovulation today. Are you doing what? The strips, the test? Any tips to ensure conception occurs? Apart from the obvious, if your ovulation is today, Mel, then your time was 2 days prior to today. Yeah. So if it is Friday today and ovulation happened today, you needed to be intimate on Tuesday and Wednesday. That was the ideal time. 2 days. And now it is when ovulation is happening already, it may already be late. Yeah. Have you ever done your temperature? Have you ever tracked your temperature? You're tracking your temperature? Yeah, so your timing was Tuesday and Wednesday. You need to do temperature. When the ovulation is actually happening, which is when the cervical mucus is seen, the first sign of cervical mucus, you need 2 days prior to that. 2 days prior to that. And the best thing to make sure the conception happens is that I hope sperm analysis test has been done. Yeah. How long have you been trying? Ramesa, is there a way to know whether you will ovulate on the left or right side? Not without a scan. You can do a scan, keep doing it, and then see, okay, most likely that there is a follicle here and it will release. You still cannot be 100% sure, but the only thing that will give you a better indication is a scan. How does that matter? All you need is an egg, yeah? Ramesa, how does that matter? Why is that a question? Holistic fertility solutions. If you are looking for fertility solutions, ask a question, share your journey, share your experience, your frustration. What else have you been told? What is not working in whatever you're trying to do and it is not working? I had an ectopic pregnancy and lost one right tube. Right. Some people are so free, you know, they just have got nothing better in life to do, just sending random people random requests to go live with. Holistic fertility solutions is the topic here. If you're looking for fertility solutions, if you're looking for answers for your situation, whatever that situation may be right now, which is not serving you, which is not helping you, which is not helpful for you to get pregnant faster and healthier, ask a question. Share your journey, share your thoughts, whatever you have, whatever is going on in your head. Hi there. Ask a question. Let's see. Holistic fertility solutions is the topic here. Feel free to ask a question. Share your journey. Hi there. Black Colt. Hello. She good or no? What is that? Black Colt. Yes. Do you have a question? Are you trying to get pregnant? It is interesting. It is very, very old, ancient remedy used in Ayurveda, which modern science is also using now. So, yes, it is interesting and effective. I do have blocked tubes, right? How long have you been trying? How old are you? $37 and been trying for 3 years. Right. So your tubes obviously have been checked and have been told that they are blocked. Yeah. Have they done any procedure in order to try opening them? Black Gold, where are you based? My clinic is in the UK. Just found out that they both are blocked. Right. What other investigations have you had? And your partner? Bournemouth. Okay, you're in the UK. So has your partner been tested? Yes, and he is okay. Right. So what have you been told? You've been given the option of going for IVF. Right. I'm just still in shock. Yeah. How's your health? Underweight, overweight, how's your health overall? What else has been checked? Okay. Are you doing any exercise? Breathing exercise, yoga exercise, walking, spinning, walking up and down the stairs? Thank you. I walk every day at work and up and down the stairs for most of the day. Right. Ruth, hi. 43 years with no period. Is there hope of getting pregnant? 43 years old, no period means how long have we not had a period? If you are in menopause, then it is difficult. It's not impossible, it is difficult. What other kind of exercise I recommend? I normally recommend any exercise that moves your pelvic area. So spinning, for example, is a great exercise, or cycling if you can cycle, or even to pretend to cycle, so that the pelvic region and the upper thighs can move, and you need to move those joints, pelvic area. And going up and down the stairs work really well, but not at your leisurely pace. It is when you are doing it as an exercise, going up and down continuously. And then there are other exercises in yoga where you open up your yoni, you open up your vaginal and pelvic region so that there is more blood flow to the area. So that is going to help you to have better vaginal health and uterine health as well, right? So yeah, all of those. Niv, hi, I'm trying to conceive. My last period was 23rd of July. No period last month, and I am not pregnant. Right. Niv, does your period go missing before, or is it related to perimenopause? How old are you? GP won't help? Why not? "35, never had a missed period." Okay, so you're not perimenopausal or anything. Yeah, so why is GP not helping? You trying to get pregnant? Stress can affect it for sure. If you have had extra stressed out time. They won't do blood test for this. So what's going on with the stress? What stress is this? And how are you managing the stress? So you're not eating well, or you're eating too much unwanted items, unhealthy items. Millie? Good afternoon. I've had lower back pain and sharp pain on my left side ovary. That could be anything, Niv. You will have to ask your GP unless you want to go private and get it checked. Not blood test, but a scan to find out what is happening. Otherwise, you can wait also. If there is no other option, unless you want to go for like a private scan, that is the other option. No, you can't do anything else. You can, I was asking you about stress. You can do remedies for that. You can do stress management is what you need to do if stress seems to be affecting it. Stress can stop your period, start your period, make it all over the place. Stressed over 2 years. That is a long time to be stressed about. What's going on? How can you take that much stress? How do you deal with it? Anyone whose mind works in overdrive and they are aware of it, that their mind works in overdrive, that you cannot stop this and you are constantly overthinking and you think all kinds of scenarios which may never happen to your life in your life, then you definitely need to know about mindfulness practices. You need to know how to calm this down, because otherwise it will affect every part of your living and health. Pressure to get pregnant at 35 in a Desi family. That pressure is not on you. That pressure is on you and your husband equally. Don't take that pressure. It's not yours to carry. Take it out today. Desi or non-Desi family, anywhere, wherever anybody is giving you any pressure, why take that pressure? And your husband has equal pressure. Has he been tested? I don't understand why Desi families don't understand. What is wrong with Desi families or any family which is just putting all that pressure? Why do you ask a woman? Ask the man also. Why do they ask a woman? Or just even give hints to a woman? Why? That's really backward thinking, you know. Has your partner been tested? I I would never take that kind of pressure from anyone, my family or anybody else's family. Seriously, you have a life to live. You are doing your best and doing your things. Why would you take pressure from anyone? He is being tested. He is normal. Tell me his numbers. Let's see how normal is he. Motility, morphology numbers. Only because his doctor said or GP said or IVF clinic said that he's normal and he's fine doesn't mean it is optimal. Okay, do not take that pressure on your head. It's too much to carry. It's too much weight and it is unnecessary. It is unproductive. It is not helpful at all, and it is not your weight to carry. Is he equally stressed out like you? Tell me motility, morphology numbers, and look at motility. You don't even have to tell me. Look at the numbers. Motility has to be above 50% and morphology has to be above 50%. I can guarantee you that he does not have that kind of morphology. So he is equally to be taking that share of responsibility and taking that pressure. So take that pressure off your head and heart. Just seriously, just don't do it. Don't ruin your health and your mental peace. You understood? 50%. Okay, look at the numbers today whenever you have them. Good. Fertility pressures should be on the couple, both of them. Doesn't matter whose issue it is, still it is a couple's issue, and the pressure should be on both of them as partners. It's nobody else's business. Nobody else's. Anybody else has a question? Otherwise, thank you so much for being here. To be very honest, I don't want to swear on the live. I really don't give a damn whether you have one tube, low AMH. Not that I'm not concerned about your health, but that is not the whole picture. Fertility is very complex, and I as I told you, I can guarantee his numbers. Morphology generally is low with Asian men. Okay. So morphology, as I was saying, is generally low with Asian men. I have not seen a man who has got morphology high. I see these results daily. So it is not because if you have these numbers, and low AMH even doesn't mean anything. One tube still is perfectly fine. So you have seriously nothing to take pressure of. You can certainly be more active, do things, but both of you need to do those things, not just you. So it is really because you have this issue, then he should be working on his health even more than you, because one person is slightly compromised, which I don't think you are, but he can then do what is he doing to improve his health. nsk.n.s.k. How can I find out if I have PCOS or not? You'll have to go to your GP and they will check your blood test and they will do a scan, and then they will tell you whether you have it or not. You're welcome. Hi there. Hello. Forever Flawless Beauty. I am having treatment, Shirodhara, and massage. Okay. Brahmi too. But my constipation issue is there with. Right. Why are you doing these treatments? I think it may be related to PCOS. NSK, what may be related to PCOS? Struggling to conceive, right? And your husband's sperm analysis, has that been done? For fertility, trying for 2 years, right? Where are you having these treatments? What else are you doing? Okay, why are you having Brahmi? Tell me the normal numbers for your husband, NSK, motility and morphology numbers. Normal is not good. We want optimal numbers. We want higher numbers, yeah? Forever Flawless Beauty. Is there an Ayurvedic doctor involved here, or you're just doing it on your own? Whereabouts are you in the UK? Why are you using Brahmi? Ayurvedic therapist or an Ayurvedic doctor? Some other powder mix. Okay. What about diet and nutrition? How long have you been seeing her? How many treatment sessions have you had? Did you do the dosha assessment? Are you working on your diet according to your doshas? Right. So she has been doing basti, yeah? Then there should not be constipation issue. NSK, you have to tell me here now, or otherwise just check that the numbers need to be higher than 50%. If not, then he equally needs to improve his health. So how else are you working on your vata? How many bastis you have had? 5 bastis. Every practitioner works differently. Um, so yeah, whatever she has given you, if it is constipation should not last for that long. How long have you been working and doing all this protocol? How many months? 2 months now, and the constipation hasn't sorted. Forever flawless beauty, either you are not doing the work that she's asking you to do, or there is some other issue. Do also remember, if you're a vata person, you have to know how to manage your mind. If you are not able to do that, then your constipation will never go away. Yeah. In addition to that, you can do oil enema. You can also do decoction enemas as well, which are different bastis. All of that. But the issue is this: for your constipation down below, your issue is this. If this is not working properly, and if you're too tense, if your too mind is in overdrive, then you will always have constipation issue. Yes. And chronic constipation, if you have, then one oil basti is not enough. You need a bigger protocol, you need a longer protocol, you need more help with this. And I also feel that you may not be doing everything what she's asking you to do. I have dates every day with one walnut in my cooked apples for breakfast. Right. Okay. Okay. If it hasn't worked for 2 months, then there is some gap here. Yeah. I'm talking about the gap, that there is a gap in communication. What she is asking you to do, what you are actually doing, and also overall understanding where the issue lies. So there is a gap there. But yeah, you can book a consultation. We can look at your case if you want. Otherwise, go back to her. You need to reassess. She needs to reassess. Right. Are you doing breathing exercises? Has she recommended prescribed breathing exercises for you? Before bed? No. Which breath work are you doing before bed? What time? What? Who does breath work at 10:30 p.m.? Whose recommendation is this? No. Stop. Forever flawless beauty. The bedtime is also wrong. 10:30, 11 o'clock is too late to sleep, and you don't want to do any breathing exercise at 10:30 p.m. No. Yeah. Before bed is when you are sleeping at 9:30. Then, and those breath works are very gentle, simple, deep breath work that you might do just to calm yourself down. You don't want to do anything extra. All other breath works are during the daytime, before lunch. Pranayam is not to be done at night time. And if you're trying to balance your hormones and with all these issue that you're talking about, spotting and everything, it will never solve if you're sleeping at this time. How bring back my period? 37 age. Hopefully, hope. I need some more information. History, medical history, Ayurvedic history, to find out what is going on with your health to be able to advise anything. Right. Thank you everyone for being here, listening and watching and asking your questions, and also those who share and like and give gifts. Thank you for doing all of that. If you want to reach out for one-to-one, book a consultation, reach out via the website that I've shared earlier. I can share it again for anybody who is looking for more solutions, going deeper into your health and going deeper into your fertility by improving your health and improving your fertility holistically. Reach out via the website and also check out various guides that we have available. We have herbal medicines available on our website as well, so check those. And yeah, and reach out. I had regular period. It is 4 months no period. Okay, hopefully hope you can book a consultation. We can look at your case. Yeah. All right, thank you everyone. Bye bye.